everybody. I just want to thank you guys for coming in today. We're going to be talking about an evidence-based project to reduce the incidence of CAUTI. Catheter-associated urinary tract infections are one of the greatest concerns in the nation currently. The data that we've compiled from this facility has definitely indicated a need for analysis of our current processes and procedures, just to make sure that we have an impact on reducing the number of the CAUTI incidents in the facility. As nurse leaders, we always have to make sure that we are constantly reevaluating our processes and procedures to ensure that we're providing safe, effective, quality care, improve patient outcomes, and make sure that we maintain reduced costs for the facility. Many of the incidents of CAUTI is created from preventable human error. And so we need to definitely look at our current processes and develop strategies for new procedures. We also need to make sure that we're utilizing a multidisciplinary approach to try to develop best practices for every unit. According to the CDC, currently 15 to 25% of hospitalized patients receive a urinary catheter, so that's a huge population of our patients that we need to be concerned with. In excess of over 500,000 CAUTI cases have been reported to the CDC annually. It's obviously a big problem, even in lieu of all of the technology that has been implemented over the years recently. CAUTIs result in poor patient outcomes and, of course, increased financial costs for the facility unnecessarily. So why do we need to change? We have numerous incidents of CAUTI in our facility. It also expands our hospital stays, which increases workload for nurses, and by the calculations that we have come up with, they decrease unit efficiency by 9 hours per week per nurse due to increased patient workload. The most important reason is it increases patient risk for disability and mortality. Which also, of course, leads to decreased customer satisfaction and decreased employee morale. When you have everything feeds into each other, and so when you have decreased customer satisfaction, that reduces, the incidence of referrals for our facility, which can potentially decrease our future revenue by up to 20%. A multidisciplinary team has been put in place to start to analyze this and introduce best practices for our facility and make some changes. They conducted interviews, studies, and focus groups along with surveys to determine some of the root causes or the major root causes that we can currently affect change on that may reduce CAUTI incidents. Some of the root causes of our CAUTI incidents that have occurred in our facility are we need to analyze the necessity of catheter placement, missing in the current documentation. There's just no way to put that in our current documentation as of now, so we need to make adjustments to that process. There's also a lack of training for RN protocols for the placement, maintenance, and removal of catheters. There's also found a lack of standardized schedule to performing pericare for our maintenance processes with patients with urinary catheters. There's also found to be inconsistent multidisciplinary protocol for placement and removal, as well as maintenance within the facility. And again, that there is a lack of accountability and performance measurement between our nursing staff and the facility. Our team, determined the PICO question for our evidence-based project, and that would be that patients that with catheter-associated urinary tract infections, if we standardize the guidelines for the catheter placement, maintenance, and removal, will that reduce our incidence of CAUTI? During the research process, we found that other facilities have implemented new processes and procedures for reducing CAUTI and have been very effective. They've developed unit-based safety programs that reduce incident of CAUTI. And another large portion of that is the continual monitoring of compliance to those new processes. Definitely, and as always, unsaid being that we want to implement best practices as put forth by the Joint Commission. And this particular facility actually had proven reductions in the rates of CAUTI incidents. Cost is another cause, and for our evidence-based procedures and our project to reduce the incidence of CAUTI, obviously $1,200 to $2,400 per incident per patient is quite a significant unnecessary cost. Also, currently put by the Joint Commission with, the Office of Medicare and Medicaid, they are declining hospital reimbursement that are involved with CAUTIs. And again, it increased hospital stays. They have proven the success of the nurse-driven process in implementing new procedures. The risk of infection increases by 5% each day that a catheter remains in place. That's why it's of great importance for us to standardize our processes within the facility to make sure that we are have nurse-driven protocols to take care of the actual, the necessity of placing a catheter, the maintenance care of that catheter, and the immediate removal of that catheter as soon as possible. Of course, there's studies that have proved the link between nurse satisfaction and patient outcomes, as well as the perceptions of their professional practice and work environment has been linked to the job satisfaction. So utilizing best practices is beneficial all the way around, to the nursing staff, to the patients, and to the facility. So what can we do as a project to actually start implementing some of these procedures? Well, to tell you a little bit about the team that was put together for this project, we included a representative from the surgical unit, a nurse from the surgical unit, a nurse from the ICU, a physician, an infection control officer, an ancillary staff representative, and 2 patient care technicians, okay? I think it definitely, when choosing that type of staff, we wanted to get that multidisciplinary approach and entirety of the personnel representation within the team. Two sessions were held for staff from the surgical unit, and then of course they had 2 sessions for the ICU. A total of 16 staff members from various positions and shifts were asked to participate in our focus groups. All of the historical data, of course, was again compiled once approved through HIPAA, so that we had anonymous data on rates and placement of urinary catheters. Once the team analyzed all the data, they provided recommendations which update RN-driven policies, okay, and perform in-services with all staff members. They also recommended to add a mandatory field for physician documentation of catheter necessity. We need to meet those standards and try, as recommended by the Joint Commission, to not place a catheter unless absolutely necessary and exhaust all other means. The next recommendation is to create standardized protocols for catheter placement, maintenance, and removal to be used facility-wide. And of course, create bundles with standardized equipment and checklists and reminders to be used from the time the catheter is ordered all the way through the removal process. Also, it's recommended that there needs to be a link between CAUTI incidents to the departmental goals that relate and are included in employee performance evaluations. Recommended timelines, of course, would be 1 to 2 weeks for administrative approval, supply ordering, implementation, and planning. 2 to 4 weeks for staff training and proper communication amongst staff through different units. And 2 to 3 weeks to spend on evaluating the pilot phase for effectiveness and the need for changes prior to full-scale across-the-board implementation. The 2-week pilot phase, there will be solutions will be implemented in a specific selected area so that to ensure the effectiveness and make any changes that are necessary, again, prior to the implementation of the full project. Evaluation of the project and the new processes will definitely be ongoing. That will be a critical portion of the success and the sustainability of this project. The data will be monitored by the team members on a weekly basis for the first 6 to 9 weeks to facilitate that control over the changes and make sure that they are being maintained throughout. They're going to pull data for analysis, for the team members as well. Of course, the number of CAUTIs, and then the number, and also, of course, the number of catheters placed, among other data. We anticipate the outcomes to reduce at least by 50% CAUTIs over a 6-month period of time. It's definitely, that will always affect your patient and improve your patient outcomes, which ultimately has been proven to improve personnel morale and reduce hospital stays, which will also reduce unnecessary incurred expenses. Utilizing a multidisciplinary team approach to analyze and implement new procedures to reduce the CAUTIs will definitely lead to success, particularly if we begin on an individual basis. The goals of this project will result in reducing the number of CAUTI, because they not only improve our patient outcomes but reduce all overall operating costs for the facility because it increases in reimbursement rates as well. Understanding the advantages of standardized processes and quality control through strategically implemented best practices will improve overall patient outcomes and nursing performance. It's all tied in together. But our main goal, of course, is patient care and improving the status of our patients. So, do you have any questions? Any comments?
Have you guys already rewritten the new RN policy?
No, that is currently in process.
Mm-hmm.
Yes.
I can assist with writing policies if you like.
Well, we're always up for teams on particularly on a volunteer basis to come to our multidisciplinary team.
Okay.
And yeah, that would be a
Just
great
keep me in mind.
assistance. I will certainly do that. Anything else?
Very good, very good.
Okay. Well, thank you so much for your time again. I appreciate you all coming out today.
Thank you.